Well, good afternoon, everybody, and welcome to GPA Live. I'm Ron Aaron, your host. Ron Aaron Eisenberg, delighted to be with you. And we've got a great show for you today. We're going to be talking about the impact of stress on chronic pain. GPA Live is brought to you by a Global Pain Association educational series, a virtual education series, and it's something that we do every single Saturday. Our special guest is Dr. Marianne Pinkston. She herself is a pain warrior, struggles with rheumatoid arthritis, and facilitator of our new GPA Warriors Support Group. Now, before we introduce Dr. Pinkston, let's visit with the founder and president of the Global Pain Association, Dr. Susan Blackwood. Susan, good afternoon.
Good afternoon, Ron, and thank you again for moderating it. You're absolutely fabulous, as well as your producer wife. And we couldn't do it without the Eisenberg Group, so thank you so much. Global Pain Association is so indebted to people like yourself and Dr. Pinkston, who will be up next. And I know everybody's going to really enjoy her presentation, but as much as she's done as a board member, we're all volunteers, and running the support group, we're so grateful for her time, resources, and attention to all this. And I want to thank our volunteer board and our advisory council. They've worked tirelessly since 2017 when we started the organization to help chronic pain patients and their caregivers find alternative ways to manage their pain. And we had an immensely successful presentation in 2019 in person. And then, of course, with COVID, we've done a little pivot and started this virtual series. And now we've reached over 73,000 people with this series in 1 year.
You're going to give us some information at the end of Dr. Pinkston's presentation on how folks can get involved and how important that is. And in the meantime, if people want to sign up and want to be part of the newsletter, go to globalpain.org. Susan, anything else you want to share with us?
No, I'm just looking forward to Dr. Pinkston's presentation. We all have had stress this year, and especially people with chronic pain. All of us really need to pay attention to some of the tips that she's going to be giving us.
Well, we're going to introduce her in just a moment. Thank you very much, Dr. Blackwood. We appreciate that. And if you are in our chat room or you want to jump into the chat room, please remember to share this program so that folks who are among your friends can tune in and see it. And we can therefore expand this reach to literally hundreds of thousands of people who struggle with chronic pain. It is so widespread. Now, I want to introduce Dr. Marianne Pinkston, who is our presenter today. She's the owner of Pinkston Medical and Wellness Clinic, family practice, and integrative medicine specialist. Dr. Pinkston is a board member of the Global Pain Association. She herself is a chronic pain warrior. I mentioned she has rheumatoid arthritis. She's facilitator of the new GPA Warrior Support Group and a specialist as well in hormone replacement therapy and weight loss programs. She is someone who has lost 162 pounds while suffering chronic pain. And we shared a few weeks ago some of the photos, Dr. Pinkston, of a former you that's hard to believe.
Right. Thank you for those accolades, Ron. Yes, dealing with chronic pain is something I've done for 15 years, and I've had enough, but I keep going. And, stress is a huge part of my life. And that's why this topic today is so near and dear to my heart, because I want to try to help people understand how I do it, because it's all of us. You're right, Ron, it's all of us. And so we need to learn some better ways to cope and adapt.
Well, you got some great tips, and bring up the first slide, which leads us right into a discussion of chronic pain and stress and ways in which we can combat that.
Exactly.
And as you think about stress and pain, Dr. Pinkston, among your clients, whether you have chronic pain or not, stress can be a killer.
Chronic pain or not, you're right. Stress is a killer. Stress is at the basis of everything I feel that we suffer from in every single disease. And I think the reason for it is because of the way that it it causes our immune system to go overboard. Our immune system is very, very important, and inflammation is we think of it as a very bad thing, but really inflammation is there to provide a service. The problem is when, inflammation and the immune system go overboard and go on too long. So, when we think of immune system activation, when it's activated to, improve and rebuild our bodies, there's good stress and bad stress. So good stress can be when people are planning for a wedding, or, buying a new home, or, all these great things that can happen in life, as well as the bad stress going through financial issues, family problems and things like that. But stress is stress, and it causes pain. And, when inflammation goes overboard and goes on for too long, prolonged stress is very maladaptive. So it causes the, pain and inflammation from just a long-term, reproduction and increased amount of inflammation that occurs in the body. The adrenal glands that sit above our kidney signals to our brain that we need to go into a fight or flight pattern. And that is, basically the bear is chasing us. And so we've got to run for our lives. So our muscles tense, our heart rate increases, our blood pressure increases, inflammation increases. And all of that is signaled to the brain, and our immune system goes lower. And so we aren't really able to protect our bodies from, the onslaught of things that are coming at us. And when you get that adrenaline surge, you also get very, very anxious. You get this sense of impending doom. That is something that can also drag us backwards. The increased cortisol, our stress hormone, causes that chronic long-term inflammation. And when inflammation is increased all the time, pain goes up and anxiety goes up. So you can see how it's all tied together intensely. And those, increase in muscle spasms, tight muscles and things like that, of course, is going to increase pain and neurological problems that are going on in our body as well. So stress and pain influence each other, actually. And I mentioned anxiety on the next slide. I mentioned that increased anxiety. There are times where, just the pain and stress itself causes inflammation, and it compounds that pain and makes it worse. So we always have increased anxiety when we're under pain. It's, will I ever get better? Am I going to just keep getting worse? Maybe, you're thinking, am I going to die? Am I going to become disabled down the road? When that happens, I won't be able to work, or I can't work much now. I can't do what I used to do. Patients are always, or people are always, and me too, are always having this fear of moving and getting up and getting exercise. Am I going to make myself worse? When you can't work, there's always that load of the financial worries. But when patients are talking to me about getting, help and treatment, a lot of patients are very fearful of their treatments. They're afraid of side effects, or they're afraid that it's going to cause some long-term damage to the body. I think one of the big ones is not being believed. So I know patients, and this happened to me too, that, sometimes you feel like you're not believed by your doctors or by the whole medical, group, nurses even, or from your family members or from your friends. And that can lead to a lot of catastrophic thinking. The more negative thoughts that we have, the more emotional distress that we have, the more that stress hormone goes off, and the more that, your pain can become increased. And that is also a part of patients not being believed. There's a lack of resources and support, a lack of education. Patients can't get to the information that they need. They can't get to people who they feel like believe them. And these are all things that influence patients underneath, and me too.
Dr. Pinkston, I've heard you say that when you were trying to figure out what was going on with you, before you had a definitive diagnosis, you had a physician say to you, well, I think you just ought to go to see a psychiatrist.
Absolutely.
As if you were making it up.
Yeah, and that is absolutely the truth. So, people need to understand this happens to physicians too. I mean, I'm very capable of knowing what's going on in my body. And, we discussed yesterday a little bit about how sometimes patients, and somebody even like me, who's just a person who gets up and goes and does what I need to do, I dress up, I work out, I, do my hair, my nails and makeup. And so a lot of times people will maybe not understand that I'm hurting a lot underneath or feeling terrible. So I think patients are like, well, you don't look like you feel bad. And I know other people go through that too. You're trying to make the best of your world and look as best you can, but patients sometimes just don't feel well under there. And yes, I did have a physician for 3 years. I knew I was sick. I went to many different doctors, got turned away and punted to the next doctor. That happens a lot. And I did have a doctor tell me just to go see a psychiatrist. Maybe I was depressed. And that's when I fell into the arms of, so to speak, of Pendleton Wickersham, who is one of the board members and speakers for Global Pain, who has taken care of me for over 10 years and been just a godsend. So, it took me a while, 3 years, to find somebody who would believe me. That's very stressful. It's really terrible for patients. I know they go through that too.
Now, you've also mentioned how tough it is for you sometimes to get up in the morning, but you push yourself to do that.
Absolutely. That is, that takes a lot of effort to get up in the morning. There were days where I would get into the shower and sit there until the water would run cold and just say, I gotta go. Or I'd hit the snooze, 20 times and just drag myself out of bed and be late to work. And, these are, if I own my own business, and if there are people who are doing that at a job, they can get fired. There's a lot of repercussions when you feel bad and can't get up. So that's where, I got into the ability to lose the weight and get up. And, I changed my hormones and I changed what supplements, my nutrition. I changed a lot of things that it didn't completely kill all the pain and disease. I'm still very sick, but it changed my ability to live my life and the quality of my life. And so that kind of leads us into the next slide. When you think about, trying to treat yourself, I think we're always looking for that shot or that pill or that therapy that's going to change us and fix us and get us back to our life. And sometimes it's not that at all. Sometimes it's really, it is that, but what I think people need to understand the most is that it's about self-care. There are a lot of things we give up. And I mentioned yesterday that women sometimes are in the position where we throw ourselves under the bus because we're taking care of so many people. We take care of our kids, we take care of our employees and people at work, we take care of our elderly parents. And, we've got so many different roles that we play. And I think the first thing we give up is self-care. I know I did, and I see patients do it all the time. So when you're thinking about, taking care of yourself, you've got to go back to the basics. So I highlighted, each one with a little bit of a description, but basically good nutrition, exercise, feeding your body and your soul, your spirit, educating your family and increasing your support, getting plenty of sleep, and then socialization. These are the things that really do very, very scientifically push us forward. And so with good nutrition, it's more than just eating right. Yes, we need to eat right, but we really just need to nourish. It's not about dieting and dropping your calories. It's about feeding your body the right things so that you boost your immune system and you treat your stress and build muscle and things like that. Yes, we do want to lose weight, but when you are encompassing a good lifestyle, you're going to lose weight with that. And so you definitely, want to, eat right. And one of the things that I do and changed, I used to eat to kill my stress, but I would eat carbohydrates. So it could be sweets or chips or salty things, but I would eat food to make myself feel better. And then right after, I would feel intensely guilty for doing what I just did. Now, what I do to calm my stress is when I eat something good and nourishing for myself and I have a successful day where I ate right, that calms my stress. So I use eating right to fix my stress too. But you always have to get, somebody involved. People can't just go on Google. I mean, you can, but it's better if you don't just go on Google and search out. There's a lot of myths on there. I think just choosing a keto diet to drop weight, those are things that can work against you. So get a nutritionist or a trainer like I did. I've got Sonia, who I work with very closely, or get a doctor, somebody like me who knows how to help you with your nutrition. It's much, much better. And that leads to exercise. So, many patients feel like if I exercise, I'm going to hurt myself or I'm going to make things worse. And the answer to that is no, you're not. Yes, it is okay to exercise. You just start slow and then get somebody who knows how to show you what to do. So you have good form and you know how to build up to the right exercises in the right way. When you build your core, your stomach and your low back, and when you begin to build muscle and drop weight, pain improves just immensely. I know that exercise increases adrenaline and endorphins, and those are things that in the right way adrenaline can, but those are things that help to improve your state of mind and your anxiety and your pain. So, you can get physical therapists, you can get a doctor to show you, you can get a good life coach, a trainer. That's what I did. And that is something you can do. It does make you better. It will not hurt you if you're doing it right. If you are feeding your body and your mind and your soul and your spirit, people think it's really hokey, but meditation is absolutely amazing. And there's so much science behind it. They have shown that the neurological endings in our brains and our body actually heal and grow with meditation, that our brain can control our adrenal glands and our stress hormone and lower it. You can improve your sleep, your mood, your outlook on life, and you can do that with prayer or anything sort of spiritual development, counseling, a support group like us with GPA. We have our GPA Warriors group. These are things that really do help you to improve not only your outlook and your positive thinking, but it really does scientifically improve the hormones and inflammation in your body. And if you also, I know it's a lot to educate your family. It's hard to do alone. You definitely have to increase your support. What people really need to know about positive thinking is that's not another, hokey piece of advice, that positivity, gratification, these are also things that help you to decrease negative thinking. When you decrease negative thinking, you improve your positive thoughts, then you slowly develop your brain as a natural pain reliever. And you do that as a habit. Negative thinking is a habit that you have to change, much like your eating or your exercise patterns. You have to work at it, use affirmations. And when you're developing a negative thought, you have to work on changing it to a positive thought. It's not just something that people do out there. We really work on that as a habit, and that has to be changed. One of the other most important things on here, I think, is sleep. And sleep is extremely restorative. It helps your body and your muscles regenerate and build and grow. It helps to decrease inflammation, but you have to sleep in order to get that restoration. But sometimes it's hard to get sleep when you've got so much inflammation, your cortisol is out of control. So a lot of people use sleep aids to get them into a good deep sleep, and that's a misnomer. That's not going to happen. Sleep meds keep you in a state of light or hypnotic sleep. You need to get into stage 3 and stage 4 sleep to do that restorative, pattern in your body. And if you're in stage 1 and stage 2 the whole time, it's never going to happen. Sleep meds or alcohol or legal or illegal drugs, even pain meds, keep you in that lighter stage of sleep. So you really have to work very hard at getting your sleep pattern changed. I work with people on that all the time, and that will help you as well. I think
talk to us.
Yes,
I was going to say, talk to us a little bit about sleep hygiene, how folks, there are many who will get on their iPhone way into the wee small hours of the night,
Yeah.
who will have a TV on, in their bedroom, and really it's self-defeating.
It is very self-defeating, and it's because of the light. So if you need a noise or something, there are little machines that produce, sleep noises, thunderstorms or music or something. But if the light from the phone, the computer, or the TV is much like a blue light that you can't see, but it's very stimulating to the brain. And that blue light wakes you up actually, and it will not let you go into those deeper stages of sleep. So you need to put those things away at least an hour before bed so that your brain can get into a sleepy pattern. That may be why some people can't fall asleep. They think, I can't sleep, so I'll get on my phone. Really, they're making that a lot worse. And a good sleep time habit. Remember when your kids were little, to get them into bed, you had to first get the bath and read them a bedtime story. Adults need the same thing. We need that stimulation and that downtime away from the screens in order to produce good sleep. I mentioned before, I think that there is, a lot of people use a Fitbit or an Apple Watch or something that will help them, try to track what type of sleep that they're having. But there really isn't a good, those are okay. But the one thing that I use is something called an Oura Ring. So it's OURA ring.com. And you can order that. The athletes use it. I've used it. A lot of different doctors use it for sleep tracking. It's a little ring that you wear on your finger, and it tracks your heart rate and the depth of your sleep very, very, very well. And you can tell whether you're getting those deep stages of sleep. It should only be about, 2 to 3 hours, maybe if you're really lucky, 3 hours of night. But if you're getting 6 to 8 hours of sleep, those 2 to 3 hours of deep sleep are the most important. They happen toward the end of the night. So that's really the best type of sleep that you need to get. So last on the list here is socialization. So when you're in a lot of pain, when you're disabled, when your brain and you're depressed and you're under so much stress, a lot of people tend to draw themselves into a pattern of loneliness and isolation. They tend to stay at home. And I think a lot of times people feel like they're going to be a burden, or they're not going to be able to go very far and get sick and not have a way to get out and get back home. And it's a very anxiety driven, issue to think about getting out of the house. And when you're confined like that, that creates a lot of anxiety and depression and a lot of stress, and that will increase pain as well. That loneliness is a terrible thing. With COVID, we've really experienced that. Now I think everybody can understand and see how not socializing affects us. And so it's really important that we have, when you go to Walmart, they've got scooters. There are wheelchairs that you can get through insurance, or even at Goodwill if need be. There's a lot of places that donate equipment to people. The other one, yes.
The other one in San Antonio, and I don't know about other cities, is an organization called Project Mend, which has a huge variety of medical and devices available for folks.
That is great. I'm so glad you brought that up. Completely forgot about it. Need to mention. Yes, they do have access to that. There are lots of places where you have access. You just have to either have somebody ask some questions for you or ask the questions yourself. And so these are ways of getting yourself up and out. And I tell patients too, just walk to the end of the driveway to practice and build up your strength. Walk to the mailbox next, then to the end of the block. You've got to build this up. Just go talk to your neighbors, get some fresh air, but get those things where you can access the outside and get up and get out. And then, another thing that happens to people too is I think when you are really, really sick, you begin to give up on your hopes and dreams. And maybe you can't get out and kill the world, but, conquer the world, maybe I should say, but you cannot give up on making plans for your future and trying to visualize yourself getting better and getting out and doing something beyond your disease. You just can't give up on your dreams and plans. That's the loneliest thing in the world, is to do that. One of the things that I've mentioned before in several of our other discussions and Yeah, presentations. Thank you. And you can find those if you go to GPA globalpain.org. You can find those previous talks. But I've mentioned a lot about supplements and medications, so I'm going to fly through it pretty quickly. But if you're watching this, take a picture with your phone and you can look at it a little bit closer later. But basic nourishment is very, very important, especially vitamin D. All of the multivitamins are good. B's are good. D is definitely the most important for building up your immune system, protecting your bones, but helping pain and giving you energy. Treating that cortisol, very important. And ashwagandha, licorice root, rhodiola, these are things that also suppress your appetite a little bit. You can lose weight, but they help to fix that cortisol so you're not as inflamed. Magnesium glycinate, taking magnesium glycinate is a good version of it to take orally. You can take higher dosages without it becoming a laxative, but you can also get into a nice hot bath of a lot of Epsom salt. You can also mix arnica with that or use like a CBD bath bomb. That's my favorite thing. Is CBD is not a drug, and you can use like the bath bombs. There are calming herbs, and L-theanine is my absolute favorite. It's an amino acid. It's nature's Xanax, and you can take as much of it as you need to. It will never hurt you in a million years. So sometimes patients will buy the capsules and take 5 or 6 of those things, and they feel like they're taking a lot, but it's not a drug, and it will not hurt you. Kava, lemon balm, valerian root, those are all mixed together even, are all great ways of reducing anxiety. I don't give up on medications. I know I do a lot more holistic and functional medicine, but contemporary medicine and some of the medications do have great benefits. The antidepressants, if you really need one, please don't be afraid. Just talk to a doctor about the benefits and whether, and risk too, but whether you should be on one or not. But don't give up on those. They really, in my mind, are very safe and effective. Pain medications are great. There are lots of great pain medications. You've got to be very careful about them. Talk with your doctor about them and try to stay in the non-opioid path there. CBD, yes, I really definitely implore you to buy a great brand. They are available on the street corner everywhere and in your local shopping center and gas station. Those are not places to buy your CBD. We have one of our members of Global Pain Association, Tina Peterson, who sells a great one. And she is exceedingly knowledgeable. Compassionate Cultivation, which we've had on the show before, also has great brands. I have great brands. There's a lot of great ways to get out there and get good help. It is not a drug, and our body has more receptors for CBD than we do cells in our body. So that just tells you it was made for us. And you can do baths and topicals and gummies and liquids and things like that. There's many different ways to do it. One of my absolute favorite ways of treating stress and pain is hormone replacement. And I'm a huge advocate for going all the way natural. I do not use synthetics. I do not advocate synthetics, but testosterone and the testosterone pellets that I do at the clinic are for men and for women. And I have used them myself for a couple of years with my provider. And it is one of the ways that I was able to get up, and one of the ways I am able to get up and get out of bed every day. Testosterone was the way to do it for me, and it is exceedingly safe. Technology has been around since the 1930s and 100% safe in my eyes. Anti-inflammatory herbs, arnica, bromelain, cat's claw, turmeric especially. These are all great. You've got to get good versions of this too. So again, talk to an herbalist, talk to your doctor, people who know, and get those involved. And then low-dose naltrexone. I won't spend too much on it because we really would have to do an entire show on it. This is usually through a compounding pharmacy and through certain physicians who practice with low-dose naltrexone. It's not widely known to the contemporary side of medicine, but it is also very, very safe and has shown just enormous potential long term. You have to use it 3 to 6 months sometimes. But
what is naltrexone?
Naltrexone it's a molecule that, it's a medicine, but it's a molecule that we use to help patients get away from opioid medications, or in an opioid crisis of some sort, reverse those, the overdose or whatnot. But naltrexone at very, very low dosages, microscopic dosages almost, has been shown to reduce inflammation, and it can be preventative of cancer. It can treat a lot of autoimmune disorders, a lot of pain disorders, depression, anxiety. I mean, the list just goes on and on and on, but it has to be very, very low dose, and it's very, very safe as well. And there's a lot of studies out there, even by the NIH.
Cool.
So wonderful, wonderful product.
Now, if folks want to get a hold of you, Dr. Pinkston, your phone number is on the screen.
Yes.
Pinkston Medical and Wellness Clinic, and folks can call you. No salesman will call. There's no obligation, but they can call and get a chance to chat with you and certainly follow up on some of their concerns.
Absolutely. I'm always happy to help anybody. And I know I want to take a moment to tell you too that I now have a radio show on AM 930 KLUP, The Answer. I also have a YouTube channel, have a blog, and I'm on iTunes and Spotify and all that with my podcast. And you can go to drpbetterlife.com and find all that information there and all the links. And I really would love people to go because some of these topics I've really expanded on. So thank you.
And your radio show is available on podcast as well.
Yeah, absolutely.
So you can hear it anytime.
Anytime. Not in the middle of the night. Not right before sleep, though.
Just Google Dr. Pinkston podcast, and they will pop up on AM 930, The Answer. Yes. So thank you, Dr. Pinkston. We really enjoyed hearing from you and look forward to doing it again. And thanks for your volunteer work on behalf of the Global Pain Association.
You bet. Absolutely.
Have a great day.
Thank you guys very much. You too.
Now we're going to turn back to Dr. Susan Blackwood, president of the Global Pain Association, and has some information on how you can get involved in Global Pain Association work. Susan, good to see you again.
Well, thank you, Ron. And I want to thank Dr. Pinkston. She is such an inspiration to me and to so many other people for what she's accomplished and what she does for others. So I hope she's still watching and knows how much we all appreciate her, especially me. We depend on her a lot because she is always there for us. And thank you very much, Marianne, for all that you do. And for other people that want to help Global Pain Association, we've got several opportunities. They can go to our website, globalpain.org. And donate. We need sponsors. We need donations. We need people to underwrite the series that we're going to have starting again in June and carry through the summer. We're looking for people to suggest topics for those upcoming segments that we have in June, July, and August. But certainly no small donation would help us, and we really want to thank everybody for all that they do in watching this series, sharing it, making sure that we have as much reach as possible so that the people that do underwrite the series know how much the people that are watching this appreciate what they are helping us do in terms of managing pain and finding alternate ways to do that.
Well, we thank all the people who jumped into the chat box as well today. And Dr. Blackwood, anything else you want to share with our GPA Live viewers?
Well, tune in to the Pain Warriors the first and third Tuesday of the month at 7 p.m. We thank Connectability for making that possible, and again, Dr. Pinkston for not moderating that. We've had several people, I think, that have gained a lot of hope, and that's what this organization is about, hope. And that's our theme.
No charge. No charge to be part of the support group.
Absolutely. None of the things that Global Pain does are, they're all accessible. They're all free. And we can't thank everybody enough for taking advantage of those.
Susan Blackwood, thank you very much. We appreciate it. What's up next Saturday on GPA Live, May 29th at noon? Our topic is the chronic pain and mental health connection. Dr. Shauna Corley with the Center for Healthcare Services will be with us. And if you have questions you want asked, email those to us at info@globalpain.org. Thank you to our executive producer and my wife, Gina Galaviz Eisenberg. Thank you to the board of directors of the Global Pain Association for their commitment to make this series possible. And thank you for joining us. See you next week on GPA Live.